Hi, welcome to Postcall, Beyond the White Coat, the podcast where we explore how doctors are impacting healthcare differently. I'm Dr. Selena, your host and co founder of Disruptive Doctors. Disruptive Doctors, we're building a platform to help doctors like you impact healthcare differently. And if you're not signed up yet, be sure to join the movement and sign up to our platform to connect with a community of forward thinking doctors transforming healthcare. Now, in this post call, we'll dive into stories of doctors who have breaking the mold, whether they've ventured into a non clinical area of healthcare, launch an innovative project, or champion new causes. These trailblazers are redefining what it means to be a doctor in this age and time. In today's episode, I'm excited to introduce Dr. Tan Hui Ling, a dedicated internal medicine specialist turned hospital management leader. Now, what drives a successful specialist to transition into hospital administration? Dr. Hui Ling is currently the managing director of Bagan Specialist Center, Oriental Melaka Straits Medical Center, Oriental Nilam College, and Star Life Pharma. Now, that's two hospitals, a nursing college, and a retail pharmacy. Now, her journey is a story of passion, determination, and a commitment to making a difference in healthcare. Now, listen to Dr. Tan Hui Ling's inspiring story to overcoming career challenges, navigating significant changes, and finding her path in hospital management and administration. Now, this is an episode you do not want to miss. So, if you're ready to be inspired by your peers who are leading the change in impacting healthcare differently, stick around. This post call Beyond the White Coat. Welcome, Dr. Tan. Thanks for joining us today.
Hi, Selena.
I know I've already introduced you. Maybe the audience, would also like to hear from you, like a brief introduction about yourself.
Okay, I'm a doctor by training. When I was practicing as a doctor, was very happy with my role as a doctor, even though there have been frustrations here and there. But in a way, fate had it in a way that I end up with healthcare management. And now here I am. We'll explore more about my stories in the next few minutes.
Okay, thanks, Dr. Tan. Share what's what initially drove you to a career of medicine? Was it your choice, your parents' choice? What was it?
Yeah, definitely there's an element of parents' influence. My dad was a doctor as well, in fact, a very hardworking one. So in my younger days, I used to follow him for his ward round, especially during the weekends. So that developed some form of interest in healthcare. But it was only in the later years when my mom was diagnosed with cancer and I had to journey with her, accompany her for treatment, going through the ups and downs, and even later struggling with the decision of DNR to not resuscitate. And it was then that I knew that I wanted to be a doctor to make a difference in someone's life.
How old were you when your mom was diagnosed with cancer?
I was 13, yeah, and when she was passed on, I was about 17, yeah.
Well, that must have been quite a challenging journey.
Yeah, in a way, yes. Because teenage years is supposed to be enjoying life, exploring the new you, so called. But I was bogged down part of the time, um, so called accompanying and looking after my mom. Yeah.
Okay, I know you didn't do your housemanship in Malaysia. Like, what happened after you graduated? You came back. What happened, and what drove you to working in Singapore?
Actually, I tried to apply to work or to do my internship in Malaysia, but the application took quite a while. MMC didn't respond immediately. So after waiting about, I think, 2, 3 months, I realized I'm wasting my time. So I applied to Singapore, and within 24 hours, they replied me and offered me a job. And within a week, I flew in, get myself registered at SMC, and started work. And FMC letter only came in, I think, almost 6 months after I applied. By then, I was settling down in Singapore already. Yeah.
Wow, that is fast. 24 hours and you got a response.
Yes. Yes. Yeah.
Okay, so for most of us here, the audience, they are mostly Malaysians who are, working in Malaysia, being a houseman here, MO here. I'm sure a lot of us are wondering, what's it like working as a doctor in Singapore? The grass really greener on the other side.
Yes and no. When I first started my housemanship there, I realized that non-NUS trained young doctors are being looked down. So overseas trained, generally they deem us as not a good breed, okay, if you understand what I mean. So even in a houseman year or a fellowship time, right, when the consultant asks you questions, or what's the differential diagnosis, or what's this, the NUS trained, you will just regurgitate the whole textbook out. But for us Australian trained, right, we're like, I cannot recall. So that makes us not being looked up to that well. But as we work, okay, in the end of the day, it's about who works hard, who is competent enough. And I think a very key thing is people management skills. If you are able to handle your colleagues, your seniors, and your patients well, generally you are actually secured with a job and a training position and subsequently promotion. So it's a very merit-based system. Of course, it's very, very performance-driven society. If you excel, well, you're in good shoes, you have a bright career ahead of you. At the same time, I think there are sacrifices. You want to be the best, you have to sacrifice work-life balance. There's a lot of stress involved, and you have to compete with the rest. If you like that type, then I think Singapore is the place for you to go. But if you want a more, peaceful, carefree, I just want to start on time, finish on time, then yeah, you do better think twice if whether Singapore is the place for you.
Oh, actually, that's very sage advice because as I go on throughout my career, that's when I realized that there are many breeds of doctors.
Mm-hmm.
Not all are made equal. There's
Yep.
no good, there's no bad because it's just what your priorities are, right?
Correct. Yep.
Okay, then what made you decide to return to Malaysia? Because I understand you became a specialist there, internal med specialist. You probably had your career trajectory set. And so, what made you decide to give that all up and come back?
So just as I completed my MLCP, my internal medicine training, and I was registered as a specialist in Singapore, the same year, I think when I was due for promotion to be a consultant, news came in that my dad had cancer and he also need a major op to for his heart. So I knew then that it's time to come back because of family obligation and as well as to do my filial daughter duty. So the family owns a hospital in Penang and at the same time also building a new hospital in Melaka. My dad was in charge and he needed someone to take over. So in his mindset is only a doctor can lead a hospital. So naturally the role ended up on me and the obligation also ended up on me. So I had to come back then. Yeah.
Wow, it sounds like it's external forces telling you that maybe this is the path for you.
Yeah, yeah, sort of, yeah. Otherwise, I was actually very happy as a physician in Singapore. Yeah,
Okay, what was it like being a physician in Singapore? Like, after you've done that housemanship, that
yeah.
MO-ship, like becoming a physician, what was that journey like in Singapore?
Um, I think I completed mine within 9 years, so-called the whole journey, and that's considered, I think, quite good. So right after my housemanship, I applied for, at that point of time, they call it the basic specialist training. I applied for the BST internal medicine. I completed that within 3 years, and immediately I applied for my advanced specialist training. AST. For AST, they divide it to different subspecialties. So depending on your interests, I applied for internal medicine and for pure reason that when I was working there, I realized it is a very subspecialty driven healthcare ecosystem. And when I was working with my colleagues and my seniors, I realized for a very simple high glucose, they asked us to refer to an endocrinologist from a respiratory physician. So I feel there's something not right, you know. Um, I feel like a bit shy to do that because I know the endocrinologist will scold me, okay, for referring such a, it's just not well controlled, but it's not uncontrolled, okay. So I realized I need to get myself grounded and be a good generalist first if I am to, say, pursue subspecialty training. So that's why I decided to do internal medicine as my first AST because we always had the option to add on another 1 or 2 years for another sub. But unfortunately, or fortunately, I don't know, when I finished my AST, that is when I had to get called back to Malaysia. Yeah.
Okay, what was it like when you first started in hospital management? What's the journey like? What was the challenges you faced?
Very lost. Okay, in the beginning, very, very lost because clinical work and administrative work is very different. It's a different ball game. And I had to start from scratch. So in the beginning, I rotate myself through all the different departments and different service areas. I observe what the hospital personnel do to serve a patient or to fulfill an operational goal. I dig out all the old meeting minutes and management records to figure out what's happening, how this and this link, And I think I also ask a lot of questions. I think my most common question would be why, how, why, And I had to be humble enough to ask anyone, no matter what their ranking or what their position is, be thick face and ask questions, whatever I don't know. I read up a lot. I subscribe to Harvard Business Review. They're very, very good articles on management, whether it's people management, problem solving, strategy, etc. I just keep reading, and that helps me journey all the different challenges that I had to go through in hospital management, which I think we'll explore more later.
Okay. Would you say that part of your clinical training has helped you with adapting in this new role? Because you mentioned you always ask why.
Definitely. I think the clinical training has provided a very good background, foundation. You sort of know from handling your clinical work that if you do this, it will be like that, These are the usual problems in the hospital operations. And also the principle of thinking. I think that was very helpful because in medicine, we always have your problems, it's okay, patient symptoms, which is a so-called problem. Then you come up with your preliminary diagnosis. Then you have to do certain tests to come with your final diagnosis and your treatment plan. And your treatment plan for the patient always have an option one, first option, and then you always have a backup plan as well. Option two, you have your short-term plan, your long-term plan for the patient. So that same principle applies in management. Yeah.
Okay, previously I had a conversation with you, and you mentioned that you had no choice but to make this hospital management thing build.
Mm,
Driving the hospital forward. You had no
mm.
choice. So, can you tell us how? How did this come about, and how did that shape your motivation, your drives, and your leadership skills?
Yeah, so I think the first thing is legacy and integrity because I know I'm not just on a paid job. I'm building and continuing a legacy that my grandfather and my father has built. And in terms of the hospital, it is to, do good to the community. So I know that whatever I do brings an impact to the reputation of myself, my family, and my shareholders. So whatever decision making I do, I keep that in mind. And in fact, I think Warren Buffett made a statement and says it takes 20 years to build a reputation and 5 minutes to ruin it. You think about it, you do things differently. I think, and that's me in a certain way. I'm very cautious and conscious about how I make my decisions. Also, because of this, my decision always based on a short-term and long-term gain. I want to solve problem now, but at the same time, I don't want to create new problems, and I want to solve it at the root cause. Which I realize is a bit different in the younger leaders nowadays. They just think about, hey, how to make someone happy, how to make the doctors happy, or how to make your staff happy now, so that you can retain them or recruit them. But they don't think if you do this, how about your other existing staff? Okay, how about down the road, 2 years, 3 years later? How will they impact the hospital direction or the hospital policy or finances, etc. I look a lot more on the long term, sustainable, steady growth, improvement and success, and not just quick wins or quick achievements. And I think also because of it's being a family business, I feel that I'm a bit more prudent in spending because I'm accountable to my family, my shareholders. Many times you notice staff will just say, it's okay, company will pay, doesn't matter. But to me, company may means I pay, my family pay, my shareholder pays. And so why should I be overpaying for something that we can get it cheaper? For the same quality, okay? And to me also, if you help the hospital save, you actually help the patients save their bill as well. If you spend more, the patients get charged more, right? I mean, it's yeah, that type of equation. So yeah, I think that makes me a bit different from the rest. Yeah.
Sounds like you've actually chosen to carry a very, very big burden.
Mm, Yes and no. I think, yeah, in the beginning, yes, it felt like, whoa, I got this 100-ton of boulder on my shoulder. But now I think I'm getting used to the role, and learning to enjoy it and embrace it, I would say. Yeah.
Yeah, I think a lot of people don't understand that leadership is a decision, and it's a lot of difficult decisions that you have to make for the benefit of the bigger organization.
Yes, it is not as glam as you think it is. Yeah. There's a lot more shit that you have to deal with every day than you can see. Okay. We just don't show you how ugly the shit is. Yeah.
Okay, you did mention that when you first you were first tasked to revamp Bagan Specialist Center, they
Mm,
had all of 5 computers in the whole
mm.
hospital. Can you tell us about that?
Okay. Um, Bagan is a 20, at that point of time, it was about 20 plus years old hospital. So a lot of things were done very smoothly, okay? But at the same time, not much changes, okay? So the hospital there and then, when I first joined, it was a huge difference or a huge shock to me because I was exposed to Singapore healthcare system. The whole hospital, I think namely the cashier, pharmacy store, the central store, the finance, the HR, has a computer to handle all the hospital operations. Okay, but the rest of the people do not know how to use computer. They do not know how to email communicate. It was a shock to me that my head of departments don't know how to use PowerPoint, doesn't even
Which
know how
year
to
was
use
that?
Excel. 2013, 2014. Yeah.
Well, so it's not even in the 1980s, it's in the
No, yes,
2000s.
yes, yes, yes. So it was a shock to me. Okay, the hospital doesn't have internet. Yeah, except for that few five computers that got linked up. Yeah. I had to retrain everyone. Literally, we work on the key leaders first, the head of services. I forced them to do PowerPoint presentation. It's literally hand holding them to learn how to use Microsoft Word, how to use Microsoft Excel, and PowerPoint. So once they're familiar, we started doing email communication, forced them to say, hey, you have to learn how to CC, how to email, how to reply through emails. Um, all meeting minutes have to be recorded in Word document. Memos are distributed through emails. No more the secretary go room office by office and distribute the hard copies. And no, it's such a waste of time. So we changed that with our staff first. We really so-called upskill them and get them ready. Then after that, we go to the clinical side. We work on the doctors. The doctors at that point of time, for the medical reports, the medical record they write themselves, but the medical report, they actually verbally record it and had someone else to type it out for them. So we started changing that first. You learn to type your own medical report. Okay. Of course, a lot of resistance then, but yeah. And once everyone is so-called okay with typings, okay, that's when we started digitalizing our hospital workflow. We have our EMR, we have our e-prescription, e-forms, appointment app. Almost everything is digitalized now. And this has almost been 6 years. And I think now no one can live without it. Yeah.
Wow, it sounds like a very huge project to just revamp the whole hospital, change everyone's approach to how they're doing their work.
So Pagan's challenge was, I would say, change management. And change management, I always feel that problems can always be solved, okay? But it's a people management that is the trickiest. And in a so-called old institution, with everyone's in their comfort zone, everything that is running smoothly, there's always two types of thoughts, right? If I go and rock the boat, right? If the hospital is earning you the money, doing the things right, if I go and rock the boat. But I knew then that if you don't change, in 10 years' time, you'll be left behind. We'll be the worst hospital in the region, okay? Because things have changed so fast around us, okay? Whether it's clinically or digitally, yeah, the challenge then was really to get people to buy in the new vision and say, yes, I want to do it with you, or no, I don't want. And I had to bring in new people to come in to work with them. People that everyone can work together. You also don't want to have gung ho's coming in and, create havoc in the team because, lucky or not, I would say every single staff is an asset. They have experience that no one else can replace. And we need them to come together and learn new things and grow with us. So that was the biggest challenge for Bagan. And whereas the new hospital was the Melaka Oriental was very different set of challenge. When I joined, it was halfway building. So I had to learn things like construction, hospital design, space planning, handling the authorities, not just MOH, but also like JKR, the councils, etc. And once the building was almost ready, it was more of how to set up a hospital. So you had to look into areas like HR, procurement, QA, finance, all these that I never learned before. So you just, yeah. But in the end of the day, just get things up. You just need to know enough what should be there and what should not be there. So two very different sets of challenges in my early days.
Okay, so what's your role now and what's your primary responsibilities?
So currently, I'm the managing director, which means that I focus mainly on the growth, development, and the strategy of the entities that's under me. I have my CEOs to run the operations and execute the strategies. So it's a higher level type of job. Yeah, which I'm glad because I think operations is not my strength, and operations means daily firefighting.
So, how do you see yourself impacting healthcare differently in your current position?
I think differently in terms of internally, externally. I think internally within the organization, because I'm the ultimate decision maker, I can influence how things are being decided. And to me, for hospitals, the most important is always clinical quality, clinical outcome. At the same time, because of the legacy that I continue, affordability in healthcare is something that I'm aware, and that's what I want to continue as well. In terms of externally, because of my role, I get to volunteer in different organizations. I volunteer with the Association of Private Hospitals Board, Allied Health Center of Excellence, which is a training center for allied health professionals. Um, I also volunteer with MSQH as a surveyor. So all this allows me to be engaged with different stakeholders in the industry, input my opinions, and hopefully that helps to drive and shape the future of healthcare in small ways. Yeah.
Wow, so you're the managing director of two private hospitals, one nursing college, one retail pharmacy. You're on the board of MSQH. You're on the
Not on
board
the
of
board. I'm just a
ah,
surveyor for
you're a
MSQH.
surveyor of an MSQH. You're also volunteering. You're serving as a voluntary position in the board
Yeah,
of APHM
yeah,
and the Allied Health
yeah,
board, right?
yeah.
Where do you time to do so many things?
Because all these are not full-time job, they don't expect us to be there all the time. So somehow, the meetings don't clash, interestingly. And because I'm not involved in the operations of the hospital, so I trust my team to solve and take the lead. So that frees me up a lot. I only sit down with my main team once a week, share ideas, exchange ideas, and most of the time I just let them run the show. Yeah. And that frees me up to do all this sidekick job. Yeah.
Okay, so I have a question now. When, in private healthcare, hospitals have to make money and you have to have profit to continue running, but as doctors, especially those that are still in government service, we solely focus on patient care without having to worry about the revenue, how much a procedure costs, how much a brenula costs. Like, we'll just use it without thinking. So, how did you deal with this at the beginning? That shift from very altruistic to needing to make revenue, needing to profit. How did you make that switch?
Um, I think when you start seeing the bills coming in, the expenses coming in, uh, you realize you better know what's happening, how patients are being charged, right? And it makes sense after a while, say, gosh, who's going to pay for your housekeeping? Who's going to pay for all the salaries? Who's going to pay for the electricity bills that's skyrocketed, building costs, all these things? Who's going to pay for that? Obviously, it comes from patient bills because that is the main source of revenue for any hospital. So once you understand that actually running a hospital and providing quality care to a patient actually requires a lot of money. It's really no joke. I think the population underappreciate that because government hospitals only charge 1 ringgit, 5 ringgit. Certain procedures, the most is 100 over ringgit. but the exact amount, the exact cost is 100 times, 1,000 times of what the common population pay. So in the private sector, we get exposed to all this and realize, hey, behind the scene, whoa, that's how much it costs to get a MRI machine, to get a cath lab machine. It's how much it costs to recruit one staff, and retain them is other a lot more costs as well. So once understanding that, it makes sense, and you also see that private patients are willing to pay as well because they want fast, accurate, and comfortable service. So it is not as difficult as it might seem, because you realize, in fact, I think some of the doctors, adjust better than me, okay? In fact, they excel in explaining the bill to the patients, okay? And patients are happy to pay. A lot of times, actually, they are happy to pay. They receive the quality care if they receive good clinical outcome and a good experience in the journey. Yeah.
Okay, so there was this article that was written. It says, "Are physicians with MBAs traitors to healthcare?" Weighing in on the great MD MBA debate. So it discusses the controversy surrounding doctors who have obtained MBAs, and the debate is whether these doctors, are abandoning their clinical duties and patient care in favor of business interests, or if they are really enhancing their ability to improve healthcare systems and patient outcome through better management and leadership skills. So, what are your thoughts on this?
Personally, I think we need more physician leaders in the private healthcare, and we need more non-physician leaders in the government healthcare institutions. Okay, so in the recent years, you see that a lot of private hospitals have CEOs from medical background, or people that in the corporate office are from medical background. And you can really see that now private healthcare is the one that is driving the clinical quality, patient safety, patient experience initiatives, and value-based care. So I think without them, it is very hard to drive all this. At the same time, you need the non-doctors to complement the doctors. Things like, improving operational efficiency, productivity, cost optimization. Honestly, I think the non-doctors are better than that. And you really need both to have a good team to complement each other and build a resilient and financially healthy organization, that can deliver clinical excellence. Yeah, it's not, it's either you or me or we die. I don't think it's that way, but we really need each other's strength, and talents, to really build a better hospital, a better healthcare organization. Yeah.
Yeah, I actually really agree with that. But I understand there's quite a lot of struggles there, communicating, getting the doctors on board, vice versa.
Yeah, but at the same time, when you have a physician leader in management, at the same time, it's so easier for them to communicate with the doctors. It's not harder because a finance person might say, "Hey, you just talk about numbers," but doctors want evidence. Okay, they see numbers, but it has to be backed up with evidence. So, and also the doctors that who have actually worked quite a fair bit in the clinical side, they seriously do understand the challenges as a clinician. So they are able to put things in perspective and maybe explain it in a more acceptable way versus a non-doctor. Yeah. So I think it really, really helps. Yeah.
Okay. Also, just want the audience to know that Dr. Tan Hui Ling was the top nominee for EY Women's Entrepreneur of the Year 2023. For those of you who don't know what it is, EY Entrepreneur of the Year is an annual award given that honors top entrepreneurs around the world for their contributions to the economy and society. Dr. Tan Hui Ling, could you tell us how did this recognition come about and what does this mean to you?
Yeah. Um, Actually, another healthcare leader nominated me, and I don't know him prior to the nomination. So when through a common friend, he asked, "Would I be interested?" I thought, why not give it a try? So that's how I ended up being nominated, and we had to go through interviews, through a lot of data being submitted, and after that, two interviews. The first interview was with the local EY team, and in the process, I think there was a lot of reflection upon my wins and my failures, and my journey in the last 10 years. And that was, in a way, very fulfilling for me. The second interview was with the judges. There was, I think, 6 or 7 of them, and they all the gurus from Bursa Malaysia, from all the big corporates, and they really ask you difficult questions that makes you think about entrepreneurship, what you have done, what you could have done differently for your organization. So that was very enriching as well. Personally, for me, the whole journey of this EY nomination was very fulfilling because, like it or not, sometimes you think, should I have gone into management? Should I just have stick to my being a doctor? I think I can earn more as a doctor. So I think that the award sort of was happened just nicely 10 years after I come back to Malaysia and took up the management role. So that affirms me that it was a good decision, um, and there was no regret. Yeah.
Okay, what advice would you give to young doctors who are thinking of going to healthcare management? Because right now we have quite a huge exodus of doctors not wanting to continue clinical practice. I'm not sure whether, I mean, they have their reasons. Some probably they got a shock. Oh, this is what life is like as a doctor. It's not the
Mm.
same as what the dramas are showing me. There are so many reasons why they're leaving. What would your advice be for these young doctors who want to go into healthcare management?
I think first thing is have a sense of purpose. Always ask yourself, why do you want to be a doctor? Okay. If you feel that there's no more purpose for you to be a clinician, then you're going to consider other roles. I think it's fair enough. But don't run away from it just because you face certain challenges or difficulties. I think in life, we all go through phases, okay? If you ask me, was preparing for MLCP more difficult or running a hospital more difficult? Anytime I would say running a hospital, okay? Number two is get as much experience as you can before you quit your clinical job. Because these years of experience, no matter how mundane you think it was, it still helps. It still helps. Whether or not it helps to have the other doctors trust you more, or the different exposure and experience in handling patients and your healthcare colleagues, all these actually build up your different skill sets that you would never realize until you face different situations. Prepare yourself if you really want to venture into healthcare management. Before I quit, I was actually preparing myself. After my MLCP, immediately I did Masters of Public Health part-time. I was still doing my my registrar calls, and in between, I was still running night class and doing my projects to complete my Masters of Public Health. But now I think there are a lot more options. You have full-time, part-time, and even micro modules, online option as well now. So you can do that, while you're still in your clinical work. And I think you can also start small, and try and see if you really like management. For example, volunteering in clinical committees or quality projects or some operational projects that your hospital might have, and use that to test whether this is something that you really want to go into long term.
Okay, that's very, very sage advice. Reflecting on your journey, Dr. Hui Ling, like, what do you think is what are you most proud of in your career so far?
Build a new hospital and transform an old hospital.
Well, it is a very big task. So, what helps you stay motivated every day to continue to make an impact in healthcare?
uh, I think having my purpose in life, as I said, for me, I have a legacy to continue to provide affordable quality healthcare to my community. So that is my purpose, and a legacy that I want to continue to build. And to keep myself sane, okay, and motivated, I volunteer, as I've mentioned, in MSQH, in APHM, so that I don't just get drained with looking at profits and KPIs, because sometimes that can be really very, very dry. And it's like, if I really want to earn money, does it have to be a hospital? There are other ways to earn money, right? So I try and spend time at volunteer on the not so profit driven, um, or more on the clinical quality side of organizations, to get myself still be in touch with what's happening, at the same time to keep myself inspired and motivated. Yeah.
Okay, is there anything else you'd like to share with our listeners?
Um, I think you've already a doctor, you're in a good start compared to a lot of other people. Your medical degree is your asset. Never underestimate that. Whether or not you become a clinician or you venture into something totally different, always believe that there's a lot more that you can do. You can make a difference in someone else's life, no matter how small it is. Just remember, one step at a time, one at a time. We dream big, but reality is we do things small, one step at a time. And I think finally is always have a purpose in life and be courageous in trying new things because you never know. Yeah.
Well, that is very, very powerful because I also had someone mention this to me. Don't run away from something just because you cannot handle it, like what you said.
Mm. Yeah.
Okay, thank you. That wraps up another episode of Postcall Beyond the White Coat. I hope you enjoyed our conversation with Dr. Tan Hui Ling and found it as inspiring as I did. Remember, there's always more to being just a doctor in the hospital. Now, if you're a doctor and you're ready to impact healthcare differently, remember to subscribe to Disruptive Doctors and come join us for our Healthcare Revolution conference and exhibition that's happening on the 10th and 11th of August, where Dr. Tan will be speaking on a forum about healthcare management for doctors. Follow us on social media, subscribe to our podcast, and don't forget to leave a review. Your feedback helps us to bring more stories of doctors who are changing the game. So stay tuned for our next episode where we'll continue to explore how doctors like you are making a difference beyond the white coat. Until then, I'm Dr. Selena. Take care and keep disrupting the norm.